Next, let's meet our research fellows. Research is important in order to improve the impact of simulation-based training and assessment and to support the development of simulation scientists in this emerging area of intellectual discovery. Our simulation-based fellowship program provides our fellows with a dedicated space and necessary resources to conduct their research. We also help facilitate collaboration and networking opportunities. I'd like you to meet Dr. Muna Al-Musleh, who began her simulation fellowship at the Steinberg Centre in December 2019 after completing her emergency medicine residency at McGill University.
Hi there. I am performing research to look at how simulation training translates into performance and to evaluate the impact that it has on patient outcomes. I am also gaining valuable knowledge about the theory and practical application of simulation in medicine and learning about all aspects of designing and running simulation-based scenarios. During the COVID-19 pandemic, I had the opportunity to work with the McGill University Health Center to offer institute training to over 160 healthcare professionals. We covered the institutional protocols on how to manage a cardiorespiratory arrest in a potentially COVID-positive patient during a code blue. It was an incredible experience.
And speaking of cardiology, here's Dr. Ricky Muller-Moran, a cardiac surgery resident from the University of Manitoba, who is completing the Masters of Experimental Surgery program at McGill.
Hello, I'm developing a curriculum that will allow cardiac surgery residents to perform new transcatheter procedures as part of their residency training. What are transcatheter procedures, you ask? Well, as an example, for some patients with aortic valve problems, open heart surgery may be considered too risky or too invasive. In those cases, transcatheter aortic valve implantation, or TAVI, can be performed. This procedure allows an aortic valve to be implanted using a long, narrow tube called a catheter. Usually, the catheter is inserted in a large blood vessel in the patient's groin or through a small incision in the chest. These are fairly new and potentially high-risk procedures, and many surgeons aren't trained on these interventions. This project would minimize potential harm to the patient and ensure that future cardiac surgeons acquire the necessary skills and knowledge to carry out these life-saving procedures during their residency training. The Steinberg Centre is the ideal place to take on this type of project, as it offers the expertise, resources, and technology needed to plan, test, and perfect these modules.
Thank you, Ricky and Muna. These important research projects that you are working on have incredible potential to impact patient care. Keep up the good work.